Hi, my name's Megan,
Hi, my name's Lauren.
and today we're going to talk to you about pregnancy. One of the most important things with pregnancy is prenatal care. Prenatal care is the care received while pregnant. This can be seen as checkups from a doctor, nurse, or midwife, helping to keep you and your future baby safe and healthy. Prenatal care can begin as soon as you know you're pregnant. These care visits occur every 4 to 6 weeks prior to 32 weeks gestation, moving to every 2 to 3 weeks from 32 to 37 weeks gestation, and weekly from 37 weeks gestation until delivery. With the prenatal care visits, you're going to have a healthcare provider. Your healthcare provider's role is to help ensure your health and your baby's health during pregnancy and delivery. Your healthcare provider will also provide educational materials and instructions throughout the course of your pregnancy. Ask questions and share any concerns you may have about your delivery. Work with your provider to create a birthing plan right for you. Remember that your plan may be altered during the labor process or delivery, and to keep an open mind. However, by working together, you can design a birth plan that meets your expectations for labor, delivery, and postpartum care, and that promotes the best care for you and your baby. There are some childbirthing classes that you can attend while pregnant to prepare for birth. These can teach you things that you never knew about labor, delivery, and postpartum care. Childbirthing classes can help to prepare you for the challenges of labor and delivery. Consider the following opportunities. You can learn things you never knew about labor, delivery, and postpartum care. You'll find out how to identify the signs of labor and what happens to your body as your baby makes his or her way into the world. You can address your fears. During childbirth classes, you have the chance to talk about your fears with others who probably share the same concerns. The instructor can dispel myths and help to put your mind at ease. Research suggests that people who take childbirth classes know more about labor and delivery and are less likely to have psychological distress than those who didn't go to the classes. You can connect with your partner or labor coach. Childbirth classes offer your partner or labor coach the chance to understand childbirth too, as well as learn how to support you during labor. You can discuss options for handling pain. You'll practice methods such as breathing techniques, relaxation, and visualization for coping with contractions. Most classes also cover the pros and cons of common medications such as epidural blocks. You can get the basics on medical interventions and possible complications. Find out how routine interventions can influence the course of labor. And you can brush up on newborn care. You'll likely get a primer on newborns. Common topics include choosing a pediatrician, breastfeeding, diapering, and bathing. To continue, a healthy pregnancy diet is very important. It's important for both mom and baby, as what a woman eats and drinks during pregnancy is her baby's main source of nourishment. Experts recommend that a mother-to-be's diet should include a variety of healthy foods and beverages to provide the important nutrients a baby needs for growth and development. Here are some tips about a healthy pregnancy diet, including what to eat and what not to eat when you're pregnant and why. Folic acid. Also known as folate when the nutrient is found in foods, folic acid is a B vitamin and is crucial in helping to prevent birth defects in the baby's brain and spinal cord, known as neural tube defects. During pregnancy, the organization advises women to increase the amount of folic acid to 600 micrograms per day, an amount commonly found in daily prenatal vitamins. Calcium. The mineral is used to build a baby's bones and teeth. If a pregnant woman does not consume enough calcium, the mineral will be drawn from the mother's stores in her bones and given to the baby to meet the extra demands of pregnancy, according to the Academy of Nutrition and Dietitians. Iron. Additional amounts of iron of the mineral are needed to make more blood in order to supply the baby with oxygen. If a pregnant woman gets too little iron, she could develop anemia, a condition resulting in fatigue and an increased risk of infections. Protein. More protein is needed during pregnancy because it helps to build important organs for the baby, such as the brain and heart. Experts recommend pregnant women eat at least 60 grams of protein per day. Fruits and vegetables. A healthy pregnancy diet should include lots of fruits and vegetables, particularly during a woman's second and third trimesters. It is recommended to eat from 5 to 10 tennis ball servings of produce each day. These colorful foods are low in calories and filled with fiber, vitamins, and minerals. Lean protein. Pregnant women should include good protein sources at every meal to support the baby's growth. Protein-rich foods include meat, poultry, fish, eggs, beans, tofu, cheese, milk, nuts, and seeds. Lean meats are meats with a lower fat content and therefore a lower calorie count. Whole grains. These foods are an important source of energy, and they also provide fiber, iron, and B vitamins. At least half of a pregnant woman's carbohydrates each day should come from whole grains, such as oatmeal, whole wheat pasta, or breads and brown rice. Dairy. Aim for 3 to 4 servings of dairy foods a day. Dairy foods such as milk, yogurt, and cheese are good dietary sources of calcium, protein, and vitamin D. Adequate weight gain. The average woman needs 300 extra calories a day during pregnancy. A woman who was average weight before getting pregnant should gain 25 to 30 pounds. An overweight woman may need to gain only 15 to 20 pounds. An underweight woman may need to gain 28 to 40 pounds. A person should gain around 2 to 4 pounds during the first 3 months of pregnancy and then 1 pound per week thereafter.
Once a woman finds out she's pregnant, it's important to do pregnancy screenings. Different tests and screenings are important and recommended during pregnancy to help optimize prenatal care and development. Genetic screening, it can diagnose genetic abnormalities before birth, and it is recommended if there is a family history of genetic disorders. Different disorders that can be diagnosed before birth include cystic fibrosis, hemophilia A, polycystic kidney disease, sickle cell disease, Tay-Sachs disease, and Down syndrome, along with others. Screening methods include alpha-fetoprotein tests or multiple marker tests, amniocentesis, chronic villi sampling, cell-free DNA testing, ultrasound scans. First trimester screening includes ultrasound scans and maternal serum blood tests. All the information about that is on the slide, along with finding information by talking to your doctor. For the second trimester screening, you want to have an AFP screening, and abnormal levels may indicate spina bifida, Down syndrome, or having twins. You also want to have an estradiol screening, and that's a hormone produced by the placenta that can be measured in maternal blood or urine to determine fetal health. Ultrasounds help to determine the due date of the infant, along with the number of fetuses, and they are able to diagnose ectopic pregnancies or miscarriages. Examine the fetal anatomy for abnormalities, check the amount of amniotic fluid, measure the length of the cervix, monitor fetal growth, and determine fetal position. You also want to have glucose testing, and that can be done between 24 and 28 weeks gestation to measure the glucose level in the blood to test for gestational diabetes. Next, I'm going to discuss working out while pregnant. Cardio, such as walking, swimming, and bike riding, are great for all 3 trimesters. Within the first trimester, you can continue exercise as normal. Other exercises that you can incorporate are pelvic curls, pelvic brace, kneeling push-ups, squats, and bicep curls. You want to include 150 minutes of cardio each week and 2 to 3 days of strength training exercises. It's good to perform pelvic exercises that can prepare you for pregnancy changes. Those exercises help with spinal strengthening, along with strengthening the abdominal muscles that will support the belly as it grows. For the second trimester, stability strength with extra focus on the inner thighs and glutes is important. Avoid running, jumping, high-impact exercises, or ones where you lay on your back for a long period of time. Add variations to squats, such as narrow or sumo squats. You can also include incline push-ups, hip flexors, and quadricep strength stretches, side-lying leg lifts, and mermaid stretch. Within the third trimester, you want to focus on cardiovascular exercises, such as walking, swimming, along with yoga and Pilates, pelvic floor exercises, and body weight moves. Next, I'm going to move on to intercourse. Sex during pregnancy is normal and safe. The baby is protected by the amniotic fluid along with the strong muscles of the uterus. Pregnancy can affect a person's sex drive. In this case, other intimate things can be performed, such as cuddling, kissing, massages, and oral sex if both partners are up for it. Sex should be avoided when unexpected vaginal bleeding occurs, amniotic fluid leaking, cervix opens prematurely, the placenta is partially or completely covered the cervical opening, and history of preterm labor or preterm birth occurred. Proper immunizations during pregnancy. It is important to talk to your doctor about immunizations if you are planning to become pregnant or already are. The MMR vaccine should be given a month or more before pregnancy. Therefore, once a woman is pregnant, she will not receive this vaccine. The inactivated flu vaccine is recommended if the pregnancy occurs during flu season. The Tdap vaccine is highly encouraged to pregnant women between 27 and 36 weeks of gestation. Pertussis kills up to 20 babies every year within the United States, which is why the Tdap vaccine is so highly encouraged. Both the flu vaccine and Tdap can not only help the mother, but it also helps the baby, as the antibodies are passed from mom to baby.
Thank you for listening to our presentation, and we hope that your education on pregnancy was advanced. If you have any further questions, please consult with your PCP or refer to our handout for areas within Portage County that you can go to receive additional support and education. Thank you.